Hello, welcome to the Mental Health Hotline. If you have paranoid schizophrenia, we already know what you want. If you have disorganized schizophrenia, I'm sorry, we're unable to understand you. If you have catatonic schizophrenia, how did you make this call? Hello my beautiful basilisks, I'm Mythology and Mind, you can call me M&M, and today I bring to you Misconceptions, because you voted for it, thank you. A new series where we will discuss psychology and hopefully destigmatize some things about mental disorders. You've probably heard jokes about schizophrenia and people saying a behavior someone has is psychotic, but do you know what does schizophrenia really entail? Because before learning about this in university, I literally had no idea, so let me share with the rest of the class. If we go to the DSM-5, we see 6 criteria someone has to meet in order to be diagnosed with this disorder. Criteria A says that a person has to have at least one of these: delusions, hallucinations, or disorganized speech, and can also present disorganized or catatonic behavior and negative symptoms. So at least one of the 3 first, but you have to have at least 2 of the 5. As these are the most important symptoms, let's talk about each one for a bit so we can understand them better. Delusions are a false belief or judgment about external reality, held despite incontrovertible evidence to the contrary. Some common delusions in schizophrenia and other psychotic disorders are erotomaniac, the individual believes that another person, usually of higher status, is in love with them; grandiose, the individual believes that they are famous, omnipotent, wealthy, or very powerful; persecutory, persistent, troubling false beliefs that one is about to be harmed or mistreated by others in some way; or of reference, the individual believes that unsuspicious occurrences refer to them specifically. There are many more, these are just some. There is not an exact statistic, but around 80% of people with schizophrenia experience delusions at least once. Hallucinations are false perceptions of sensory experiences. The most common ones in this disorder are auditive ones, where the person hears one or more voices, whispers. Hallucinations can also be visual. They can see people, objects, or an altered perception between other things. Olfactory and taste plays a role in this one too. Sometimes the person believes their food is poisoned because they can smell and taste it. And tactile, which can feel like hands or insects crawling around or inside the person. Disorganized speech can cause people to have difficulty concentrating and maintaining a train of thought, which manifests in the way they speak. The most usual alterations in speech are use of neologisms, which are made-up words that only make sense for the individual, preservation, or repeating the same words over and over and over, and loose associations, which is rapidly swifting between topics with no connections amongst them. These 3 are the main symptoms, but let me explain the other ones too. Catatonic behavior means that the individual has striking motor behavior, typically involving either significant reductions in voluntary movement, hyperactivity and agitation, or remaining in a state of complete immobility. Also in schizophrenia, apart from the ones I already said, you have mutism, so not being able to speak, peculiar voluntary movements, and echolalia, which is repeating words or sounds made by another person, or the person themselves, and echopraxia, which is the involuntary imitation of the movements of another person. Lastly, negative symptoms. The most common ones are diminished emotional expression and avolition. The first includes reduction in the expression of emotions, little eye contact, and things like monotonal speech voice. Avolition is a decrease in motivated self-initiated, purposeful, or social activities. Other common negative symptoms are alogia, or poverty of speech, anhedonia, or decreased ability to experience pleasure, and asociality, or lack of interest in social interactions. These are also seen in depression, I would know. So we have to be careful as when we associate them with negative symptoms. The next criteria are shorter, I promise. And honestly, you don't need to actually know about the other criteria, just know there are things like, it has persisted for more than 6 months. You have to rule out other things that might appear similar. This is not because of drug use or other, conditions, So, yeah. Let me tell you about the types of schizophrenia there are. Paranoid schizophrenia is the most common one, is usually developed later than the others, between the ages 30 and 35, and they have delusions and/or hallucinations. Schizophrenic or disorganized schizophrenia usually develops between the ages 15 and 25, and symptoms include disorganized behaviors and thoughts with short-lasting delusions and hallucinations. Catatonic is the most uncommon. It usually starts between the ages 15 and 30, and they present catatonic symptoms. Undifferentiated schizophrenia is when you can't put the person in either of these categories because they present more symptoms. Lastly, residual schizophrenia is when the person only has negative symptoms or positive symptoms of less magnitude. So, what are some common misconceptions about this disorder? Personally, the first one that comes to my mind is that people with schizophrenia are violent or aggressive, as this is how they are commonly represented in media. Well, that's pretty far from the truth. Most people with this disorder are more at risk of harming themselves than others. Obviously, they can be aggressive, as anybody can be, but a study showed that for every homicide committed by a person with this disorder, 100 would commit suicide. Overall, 1 in 5 people with schizophrenia will attempt suicide, with many more experience in suicidal ideation. Another one I've heard is that people with schizophrenia have multiple personalities. Well, first, that term is incorrect. It's called dissociative identity disorder, and it has nothing to do with schizophrenia. That's a whole other topic we can talk about someday, because there is also a lot of misconceptions around it. But yeah, no split identities in schizophrenia. Another is that people with schizophrenia are less intelligent. I don't know where this one came from. It's completely false. Obviously, if you're suffering with positive or negative symptoms, things like your attention or your comprehension are not at their best, but it has nothing to do with intelligence. A really common one I used to believe in too is that schizophrenia appears suddenly. I mean, it can, but it's more common to experience symptoms before having a psychotic episode. Oh, by the way, psychosis or a psychotic episode is a combination of hallucinations and delusional thinking. But yeah, negative symptoms appear before this, usually. I've read that some people believe that bad parenting can cause it. Not really. It's a combination of genetical and environmental factors, but the ones that can cause a psychotic episode are things like use of substances, intense stress, major emotional life events. And also schizophrenia usually occurs in adults. It's really uncommon for children to have it. Men usually start experiencing it at their early 20s and women at their late 20s. I think this is also a really common misconception, that people with schizophrenia can't have jobs or that they have to be constantly hospitalized. I mean, when they're having a psychotic episode, they probably should be in the hospital, but the rest of the time they can have jobs and regular lives. If they're taking the medication they need, and if they're going to the psychologist if they need them, it's totally fine. Psychosis can last between some hours and a few weeks. Some people experience this only once in their life, but most people with this disorder have a second episode between 5 and 7 years later, though it can happen before. The thing is that negative symptoms last for very, very long, so people suffer with them between episodes, and this is why it's recommended for them to go to therapy, as it helps them get better. There is no definite cure for schizophrenia, at least at the moment I'm recording this video, and it's something an individual will have all their lives. But with medication and psychological assistance, they can have a rather regular life. If you have any questions, feel free to ask, but please refrain from using words like schizophrenic or schizo, as they have a negative connotation. I hope I was able to deconstruct some wrong ideas, or to teach you about how schizophrenia actually works, because this is a difficult topic to speak about in another language. But yeah, I'd love to hear about you and what do you want me to do next. Have a nice Iron Age. Bye!